We now call the defence's expert witness, Katie Lowery, to the stand. State your name and education for the court.
Katie Lowery, Bachelor of Science, Masters of Science and Chartered Psychologist from Monash University.
Katie Lowery, does the defendant, Mr. Braun, suffer from a psychological disorder?
Yes, he's being diagnosed as suffering from a psychological disorder.
What psychological disorder did you diagnose Mr. Braun with, and what are its characteristics?
Mr. Braun has been diagnosed with delusional disorder, erotomanic subtype. Although erotomanic delusions are primarily associated with females, this disorder is known to affect both sexes. Erotomanic subtype, as described by the Diagnostic and Statistics Manual of Mental Disorders, Volume 5, is the belief that another person, often of a higher status, is in love with them. This delusion is frequently centralised on a person whom they have limited contact with, which can result in obsessive behaviour. In addition to the obsessive behaviour, the affected individual may seek further contact with the desired person, potentially mistaking the rebuffs as declarations of love. The individual may lavish the desired person with gifts, letters, and unwanted attention, which can eventuate to stalking.
Ms. Lowery, could you explain to the court how this diagnosis was established?
Diagnosis began during the interview of Mr. Braun on the 6th of March 2017. Throughout that interview, the diagnostic criteria outlined within the DSM-5 was assessed to determine if Mr. Braun was suffering from delusional disorder, erotomanic subtype. Throughout the interview, Mr. Braun indicated that he possessed feelings which he believed to be reciprocated by Miss E.B. for approximately 3 months. These feelings occurred prior to the physical stalking of Miss E.B. Mr. Braun provided a coherent and non-bizarre responses coupled with additional psychological testing were significant in the initial determination that he does not suffer from schizophrenia. He had previously been treated for major depressive disorder. Since being withdrawn from antidepressants, he had successfully managed this disorder through techniques learned during the treatment. Although he noted the delusions of Miss E.B. were more frequent and intense when feeling depressed. During the interview, he stated that he does not partake in recreational drug or alcohol use, which was corroborated through interviews with both friends and work colleagues. The behaviour displayed and identified was matched to the criteria, and we were able to establish that he suffers from delusional disorder erotomanic subtype.
Ms. Lowery, what is the most effective treatment and management for this psychological disorder?
Mr. Braun would benefit from continual medical and psychological assistance as an outpatient within his local community. This would be achieved most effectively through the utilisation of electronic monitoring, where he would remain under house arrest, only attending psychiatric clinics to receive treatment. The use of electronic monitoring allows Mr. Braun to receive ongoing social support and familiar surroundings, whilst providing relief to Miss E.B. that he is unable to continue to harass or cause her any harm. The frequency of these sessions would aim to be reduced as the delusions reduce, until Mr. Braun can successfully be discharged from the program. Further studies conducted by Stoker and Nelson confirmed that a significant proportion of stalkers have a major mental illness that could respond to treatment, and the remainder of the stalkers have significant interpersonal disabilities, whom many could respond to counselling.
Thank you. Prosecution, your witness. Ms. Lowery, you have diagnosed Mr. Braun with delusion disorder erotomanic subtype. Can you explain, does everyone suffering from this type of delusion commit crimes?
No. Although erotomanic delusions can result in illegal and intimidating activities, it is not the general intent of the affected individual. Malloy further investigates the notion that although the pursuit of contact may appear aggressive in nature, it is unlikely to result in physical harm to the victim. Although there remains a link between mental disorders and criminal behaviour, it is not a definite. Further to this, Prigg stated that the vast majority of people with mental illness are not violent, not criminal, and not dangerous.
If Mr. Braun is suffering from a mental illness, does he pose any further threat to the community? And isn't it true that research states delusion disorders respond poorly to any form of treatment?
Through receiving successful treatment, Mr. Braun will pose no threat to the community in relation to the diagnosed aromatic delusions. And it is correct that Penals did state this. Further to this, Penals reported that the most successful form of effective treatment for delusion disorders were through a combination of psychiatric assistance and antipsychotic drugs. There was also further studies identifying treatments for erotomatic subtypes through the implementation of strong social networks and the understanding of delusions, along with psychological guidance. As a result, the most effective treatment plans are a combination where the treatment can be focused on psychological well-being and the successful reintegration into the community.
Miss Lowery, isn't the safest and most beneficial place for Mr. Braun the correctional system, keeping people like Miss EB safe? Do you believe Mr. Braun will get the help he needs in the correctional system?
Although the correctional system is equipped to deal with some psychological disorders, Freckleton has identified that a sentence given to someone suffering from psychological disorders will weigh more heavily on the prisoner than it would a normal person's health. He has previously responded well to antipsychotics and psychiatric treatment. This, coupled with electronic monitoring, will provide the community, specifically Miss EB, that their safety is a primary consideration. Incarceration would fail to adequately address Mr. Braun's core behavioural issues and would significantly reduce the chance of successful rehabilitation within the community.
Miss Lowery, could you explain to the court what your assessment is of the chance of Mr. Braun reoffending?
If correct and effective treatment is not provided, Mr. Braun will fail to improve and the associated delusions will continue to occur. Through the implementation of successful psychiatric, antipsychotic and in-home treatment, the likelihood of reoffending is reduced. Further to this, Malloy explores the successful rehabilitation within the community through behavioural therapy for the perpetrator that emphasises social skills building, preferably in a group setting. Through the effective treatment, Mr. Braun can be reintegrated within the community as an effective member of society. Research by Rosenfield stated that the presence of delusion disorder, for example erotomania, was associated with a lower risk of reoffending. Further to this, Good and Pierce stipulated that long-term success of ABO provisions within stalking cases were dependent on the deterrence produced by an order and the enforcements